These are 5 reasons and questions that come up after surgery. Please watch this. And if you have any of these, especially the ones that we want you to call us about,
Hi guys, welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery. I'm Dr. Smita Ramanathan down in Jersey, and I've got my friend and co-host, Dr. Amalfi, with me. Hi girl.
Hi guys. Hi Smita.
So we have an amazing episode. This is, it's for all of our surgery patients.
Everyone.
Literally the top
Yes.
5 questions, everyone. Doesn't matter what you're having done.
5.
The top 5 questions that come up all of the time immediately after surgery. You know, we give you a lot of information before surgery, obviously during surgery, and then when you go home and you're actually in the middle of it, things come up, and so this is for all of you guys to watch, so that
yes, please watch.
You know, because these are very, very common questions that come up all the time. So the first one is,
I would say fever. People calling,
Yeah.
taking their temperature, and having a low-grade fever. In the first couple of days after surgery, guys, this is super normal. This is just your body's response to trauma, right? And you had a traumatic surgery, so it can be, but is not always, very normal. But how do we problem solve that, Smita? What are some of the other reasons that, you know, are not normal that you could have a fever?
Yeah. So, I mean, you know, when you go home, right, usually you'll have instructions that go over all of the things that you need to be looking for on your, like specifically for your incisions, right? So the normal fevers are typically just from you not taking deep breaths or moving around enough.
Yes.
You don't think about this, but after anesthesia, a lot of our little alveoli in our lungs collapse a little bit. And so we need to really open things back up again. So those deep breaths, even though they feel uncomfortable, usually I tell my patients to hold a pillow against their surgical site while they're taking deep breaths. That 9 out of 10 times will get rid of the fever. But
breathing. Yeah,
breathing, deep breaths.
That's the most common thing, is you're not taking deep enough breaths.
Right. And that also involves like getting up and moving around.
Yeah.
That allows you to take those deeper breaths. But the things that we worry about obviously are wound infections, right?
Yes.
That is rare for that to happen immediately after surgery. That's typically
it's a little
a few days later, a week later, something along those lines.
Yes.
Right.
Yeah. So look at your incision.
Very clear signs, right? It's not going to sneak up on you, and you'll know. Our body is really good at letting us know if there's a problem. So what are some of the things that we see with our incisions?
Well, when you're looking at the incision, it's going to start to look different. It's going to be super tender to the touch, and it can look really red and hot and swollen. And usually it's different, right? Like it's been feeling pretty good. You've been feeling pretty good. And then all of a sudden you should be feeling better every day. And then all of a sudden there's a few days where all of a sudden you're starting to feel worse again. That's a sign that maybe you're actually getting sick or you have a little infection, because you should be progressing. And so if your incision starts to get more tender, or you in general just start to feel a little bit lousy and you're at that week or more point, then I would start thinking about, is something going on with my incision? Is there a small infection going on? And those are absolutely reasons we want you to call. In general, we want you to call with a fever, because there's lots of things that could be going on, but I think that these we've covered, you know, as our number one question. These are definitely some of the most common reasons.
Yeah, exactly. So always keep us posted. Always, you know, we're always available. And if there's drainage too, I think I get a lot of patients, you know, they're like, how do I know, right? Like we tell them all these things to look for. It's going to be very obvious. And I always tell people,
gross.
there's not going to be a question. You're going to know.
There's
something going on.
A little drainage normal, but you'll know if something is really gross and different.
Exactly.
I would say
right.
the second call. I'm going to move on to the second call.
Yeah.
I think is that you are constipated. And I know some people don't like to talk about these things, but all of the meds that we give you make it really hard to poop. And if you don't poop, you feel terrible. Like you're just, you know, literally full of it. And You can get a really
Yes.
bad bellyache. You feel miserable. You don't have an
And you feel
appetite,
miserable.
and you can't poop.
You feel like
And
throwing
so,
up. Like it's
yes,
bad.
you just get
So,
backed up. It's a pipe, right? It's a pipe and things aren't moving out. So it's hard to get things in and keep things in. And so common after all surgery. After all surgery, we do some of the anesthesia, and then the pain medicine will
Yeah.
make you constipated. So if you are someone who's already baseline constipated, please be ready for this. Let's come at it from all angles.
I know. And start early.
What are your go-tos? Like, what's your regimen, Smith?
Yeah, so I usually, I make sure that you have to stay hydrated, right? That's the most important thing, especially for surgery itself. You have to replace a lot of fluids, electrolytes, but then especially to prevent some of that constipation. I always have patients start Colace twice a day right after surgery. You can get that over the counter, and then just stock up on things that have worked for you. I mean, I think all of us at some point in our lives have been constipated.
Yeah.
And so just literally have multiple options, whether it's prune juice or Miralax or just whatever has worked for you in the past. Just have those options so you are ready to go and you're not worried about getting to CVS to purchase it. So that's all stuff you should just have on hand before surgery. And then eventually you'll have a bowel movement and you'll feel like a brand new person. But sometimes you just need a little help along the way. Do you have any other tips or tricks?
No, those are them. Milk of magnesia, mag citrate, like whatever it is that works for you, have it ready to go. Be prepared, be proactive, and don't feel bad about taking something for a few weeks. Like even when you go once, then you don't want to start that cycle over again. I mean, you're not going to be on this stuff forever. Just make yourself feel comfortable, and this is not really a big deal. So please, just like whatever starts working, then just like stay on that regimen until you're up and moving around and a little bit back to normal. And we promise you're not going to be in this boat forever. So totally normal, but please be prepared. And that is definitely one of the most common calls and questions that we get.
Yes. All right.
How about,
the third?
How about just like the obvious of pain, right? Pain and this hurts, that hurts, and then really just like how to manage and stagger meds, I think is a really important thing to learn.
It's so important.
So that you're not bottoming out. What are like your tips for that, Smita?
So I usually tell my patients, depending on what procedure they're getting, right? They're either getting a narcotic or they're getting something like tramadol, a little step down from that. We do everything in surgery, whether it's nerve blocks or whatever, but your anesthesia also contributes to your pain control afterwards. So we
Keeping
do
you
what we
comfortable.
can control.
Yes.
Right.
Yes.
But I usually tell my patients for the first, 36 hours, 48 hours, we know that you're going to be in pain.
Yeah.
And that's the time to just stay on top of your pain medications because once you're behind, it is really hard to catch up. So I almost tell them to take these as needed medications as just scheduled. Just take it every 6 hours.
For 2 days. Yep.
Yeah. Start with the nausea medication just because it's that also creeps up on you and it's a lot of the anesthesia effects. Then eat something and then take your pain medication.
Yeah.
And then just do that on repeat for the first day and a half, 2 days. And then you're going to start to stagger and start incorporating, sort of taking out the pain pills, substituting it with Tylenol. And that really just gives you, gets you over the hump. And again, the first 2 days are going to be the worst. And then you'll start noticing, usually by that third day, people are just taking it before they go to bed, right?
Absolutely.
And they're taking Tylenol during the day. So,
make a little
just keeps
schedule
you comfortable initially.
And if you have been given more than one type of pain med or you're taking a prescription and then you're taking Tylenol, please alternate them. Make a little schedule. So if that medicine is every 6 hours, then you're alternating them. So every 3 hours, you're going back and forth between your meds because you don't want to feel really, really good and then have no meds in you and feel crummy and then go back up and down that cycle. So the more you can get a steady state of meds in you and stay on top of it, you're definitely going to be more comfortable. So those are our pearls, I would say, for pain management, which sometimes, it goes perfectly and sometimes it's frustrating trying to find the right balance, but you will get there.
You'll get there. All right. Next, swelling.
I would say swelling, and with
yes.
with garments and stuff, like if you don't pull that garment all the way up, you're going to create like a little band and then you're going to swell around the garment. But I would say be prepared to swell a lot. I always say there's almost like regret after plastic surgery because there's so much swelling that you're like, holy cow, what did I do? I look worse than I did before, whether it's from the lipo or the tummy tuck or you get really, really swollen. So expect
or even the
that.
breast surgery, right?
Yes,
if they're like, well, this is not how big I want it to be.
Yes.
And you're like, no.
It's really swollen. It's really swollen.
And it's really swollen.
It'll start as soon as you get home, guys. And then
and it gets worse initially.
Yeah, it's going to get worse. Like at 3 weeks, I think it's kind of like the worst. And then you turn the corner. But for some patients, you're going to still feel swollen for 3 to 6 months. And sometimes longer. Sometimes in thinner patients, you're going to notice that at the end of a busy day, an active day, for months. So very normal.
Very normal, and it also can be asymmetric, right?
Yes.
So that's the other thing.
Don't be alarmed.
We get a
by
lot
that.
of phone calls like,
good
the side
one.
is bigger or that. But again, we know that you're going to be swollen. Sometimes one side is going to be more swollen than the other. So don't stress about that. That's why we always say final results at 6 months to 1 year, because that's really when the swelling is going to be gone, and we can truly assess what your results are going to be. So don't sweat it. It's normal.
No.
We'll get you through it.
Absolutely. And then I would say the last thing that we get questions about is something that I really do want you to call about. I would say the number 5 thing, Smita, is a rash.
Yeah, I agree. Yes.
I get so many
Hands
rash
down.
calls. Do you get a lot of rash calls? We're doing
We
so
get
much
a lot
to your
of rash
skin.
calls. Yeah.
Yes.
And there's different types of rashes too. Some we have to be more
So
concerned
many.
about. Let's say if it's related to medication that you're taking. And sometimes it can just be normal from some of the adhesive on the tape or the Dermabond or Prineo. Some of these things that we put on the incisions can cause local reactions. So
we like to see
common.
pictures. I like to see pictures of rashes.
I like to see pictures too.
We like you to text it to us because, again, it could be something more serious like medication. It could just be a topical allergy, but sometimes that can be really serious and awful for some of my more sensitive skin patients. And you might need medication to treat the rash, an ointment, or even systemic steroids. So please just take a photo of the rash. Call us as soon as you feel it, because if we get on top of that too and we get, whatever the inciting agent is out of you or off of your skin, then that can really help with your comfort, because a rash is going to make you kind of miserable.
It's going to make you miserable, especially if it's an itchy one.
Especially after surgery. It's just so frustrating.
With everything.
So,
And the thing is, like you said, call us, because what we don't want to do is, we try to self-treat and then we start putting all these other lotions and potions on it, which then further,
could be worse.
Makes the reaction. It makes it worse. And this is also not the time, I tell people too, my patients, to this is not the time to try new products, like no new lotions, detergents, shampoos, soap. Stick with stuff that your body's used to. And because our body, the surgical site is like brand new skin. It reacts differently. It's going to be more sensitive.
Very sensitive.
So while using random, brands in the past was okay, it may not be, and most likely won't be okay after surgery. So keep things very stable.
Exactly.
That way we can really target what's going on.
Awesome. Well, these are
right.
5 reasons and questions that come up after surgery. Please watch this. And if you have any of these, especially the ones that we want you to call us about, please give us a holler. But we hope you feel a little bit more prepared after this. And we're so excited to have more series coming your way. So make sure you subscribe to Lipstick and Lipo, and we will see you guys soon.
See you guys later.